Okay, we're open.
Good evening, everyone. If you could just bear with us for a couple of moments as we're waiting for all of the registrants to jump into the webinar with us this evening. I can see those participant numbers climbing rapidly, so if we just bear with us for a moment. Good evening, everyone. We're just giving it a couple of moments for people to register and join us this evening. I can see the participant numbers are rapidly climbing. Thank you everyone for logging into tonight's Zoom meeting. We're just giving it a couple of moments for everyone to register and get in. Good evening, everyone. We're just giving it a few minutes till everyone logs in. We can see the participant numbers are rapidly climbing. Well, it's just gone 8:05, so I think that's adequate time for everyone who's keen to be jumping into the webinar. So good evening, everyone. My name is Suzanne Greenwood, and as the Guild's Executive Director, it is my pleasure to welcome you to tonight's Pharmacy Guild webinar. Now, this evening, we are continuing our focus on supporting the rollout of the COVID vaccine in community pharmacy right across Australia. But our National President will also tonight be giving you all an update about some other current developments that are impacting community pharmacy and that we wanted to update you all about. Now, I wish to acknowledge the traditional owners of the lands on which we all are this evening right across Australia as we come together for this webinar, and I wish to pay our collective respects to their elders, women and men, and past, present and emerging. So thank you to those who have lodged questions when you've registered for tonight's webinar. We have captured many answers to those in tonight's presentation and also took note of the imperatives that you wish us to keep advocating for. Now, if we don't manage to give you all the answers that you're looking for during the webinar tonight, please do email us with your queries through to the email address covid-19@guild.org.au, covid-19@guild.org.au, and we will continue to post answers to those frequently asked questions to the Guild website, and the links to the webinars are also there as well. So if you have any colleagues that you'd like to refer tonight's webinar to, they can jump onto the website and watch this evening's once it's posted, and also those from previous sessions. And there's also a wealth of other resources there too. I will now hand over though to our National President, Adjunct Professor Trent Toomey, who will be taking us through tonight's presentation and who also has a special guest that will be joining us this evening. So over to you, Mr. President, to commence tonight's webinar.
Thank you, Suzanne. And we do indeed have a very special guest with us here tonight. Ladies and gentlemen, we have the federal member for Grangler and also the leader of the opposition, the alternative prime minister, if you will. He is long known not just to the Pharmacy Guild of Australia, but to the local pharmacists in his electorate. And I know Mr. Albanese, Albo, I know Carolyn Diamantis gives a shout out to you. I know she's one of your locals there in your electorate, and she's been a long-term member of the Guild. But sir, I know you're here to talk to all of our members. I thank you very, very much. And it's my absolute pleasure to hand over to you. You're on mute, Albo.
There we go.
There we go, mate.
You muted me.
Well, I can hear you now.
Before. You managed to succeed. Can I begin by acknowledging the traditional owners wherever we are tonight, in my case, the Gadigal people of the Eora Nation, and pay my respect to their elders past, present and emerging. And can I thank you very much for the invitation to speak with you this evening. In the words of Joni Mitchell, you don't know what you've got till it's gone. We got a reminder about just what that means when community pharmacies were sidelined from the early stages of the rollout. We've grown so accustomed to the role that pharmacists play in the health of our community that I think we may have come to take you for granted. But the moment you're out of the pandemic picture as a result of a government decision, we knew that something was amiss. I myself get my flu shot every year from pharmacists, including one of your very prominent Guild members, Adele. But I always engage with pharmacists as, if you want to know what's going on in a local community, talk to the pharmacists. And because pharmacies were out of the picture, it somehow felt less surprising when we all realised that, contrary to the government's assertions, we were nowhere near the front of the queue. Now that we have you back, it feels like the world has come back a bit closer to its proper shape. And every vaccination booking sign that appears in a chemist's window is one more ticket to going back to our normal way of life. Just how important pharmacists are in our society is something I've always been keenly aware of. Many of you would know my personal story, which is growing up with a single mum in a council house in Camperdown. And her pharmacist was just as important as her doctor. The pharmacist in Ross Street of Forest Lodge there would deliver things down the road to home to my mum when she was unable to travel. It was just a service free of charge that was done, and would help very much to look after her and to manage her pain with rheumatoid arthritis and other problems on a day-to-day basis. So I certainly recognise from a very young age the critical role that pharmacists played. Not just in that way, of course, but also in informal ways. the pharmacist at Ross Street when I was a kid. We'd have lay-bys for Christmas presents and would sell various things as well as just part of the service, part of being that centre of the local community. And of course, I'm very proud that we have in our own midst, as part of our caucus, Emma McBride.
She's on the call tonight, Albo. She's in listening too.
G'day, Emma. Well, I was going to say nice things about her anyway, but Emma always reminds us of the importance of having that hands-on approach. Someone who worked as a pharmacist for 2 decades and someone who brings that expertise to the National Parliament is really important. And that's why I have the sole responsibility for appointing assistant ministers or assistant shadow ministers at this stage. And that's why I very much picked Emma, who's also a fantastic local member, of course, there on the Central Coast in Dobell. So there's nothing terribly new for Labor to have that relationship. And of course, Bob Hawke understood the role of community pharmacy to the health and well-being of Australians. And as Prime Minister, he guided the development and implementation of the first community pharmacy agreement. But no one's going to pretend that the relationship wasn't always a smooth one. And there was a chemist dispute at that time in 1990. It was all done and dusted, and Bob gave a speech to the Pharmacy Guild's AGM. And this is what he had to say. He said, over the last 12 months, the federal government and the Pharmacy Guild had something of a blue, and it was a beauty. So he called it out for what it was. It was something that Bob Hawke, of course, did. Cast a dispassionate eye over an issue, come up with a solution, and get through that. And Bob certainly did that. Even more cheerfully, he also conceded that some Guild members had exercised their democratic right at the previous federal election to not vote for him. But Bob understood better than most that, just as is the case with a good rock band, public policy can benefit from a bit of creative tension, and understood that the Guild was there to represent your collective interests. And of course, as a former president of the ACTU, he certainly understood that. But once they got through that, it was all pretty much full steam ahead. And one of Bob's most powerful instincts was to bridge differences and to seek out common ground. And he found like-minded counterparts in the Guild. It was a level of maturity that I think we can all agree we'd like to see a bit more of on the political stage today. And Bob said this, he returned at the end of his speech, he said, 100 years ago, it was the physician who was the main provider of care for the ill. Today, we take for granted that the pharmacist can dispense medication for a vast, even awe-inspiring range of conditions: diabetes, high blood pressure, cardiovascular disease, even cancer. Families have increasingly looked to pharmacists as a source of convenient, efficient and reliable advice about the health of everyone from the unborn and very young to the very old. And pharmacists have increasingly brought new skills and professionalism to the task of meeting those needs. And I think they're very true words. They were true then, but it's even more the case now. I look back on my personal experience. My mother was one of the first people to go on an experimental basis on prednisone. And that was, at the time, it would have been, I guess, in the 70s or early 80s. And that made a difference. And gradually the breakthroughs in science, just like we've seen incredible breakthroughs in mRNA vaccines and other vaccines from the time of the outbreak, just it's called COVID-19 for a reason, but it only really hit early 2020. It is remarkable that here we are a short time later, Indeed, by the end of 2020, there were vaccines available and being distributed around the world. Not enough supply here, but nonetheless, they were available, which just shows the capacity of science and the capacity of humankind to really make a difference. So it is, I think, good words then, but even more so today. And it did take some time for community pharmacies to be brought into the vaccine rollout. And that was something that I was calling for around about this time last year. We were suggesting that when the vaccine arrived, you needed to take the vaccine to where people were and to connect with people. And if you want to deal with issues like vaccine hesitancy, there's no one better than to talk to your local pharmacist. I've been to the Adele's pharmacy at Roselle, certainly does that. So does the pharmacy across the road from me, which is a Bloom's pharmacy on Marrickville Road, which has people there who speak Greek, Vietnamese, Chinese, Arabic, different community languages. And you just see the queues of people getting advice, speaking to people, developing that trust of a relationship that's so important when people are dealing with, frankly, something that's new that they didn't expect to. No one else has dealt with a pandemic in our lifetime, given that it's 100 years since the last one. So I do want to say thank you for your persistence. As an organisation, you continued to argue that you had an important role, and eventually you got there. And now, of course, you are playing a critical role. And we do need to acknowledge as well that pharmacists are sacrificing fairness in their desire to work for the greater good by getting a rebate for COVID vaccines, but not the same rebate that GPs get for the same job.
No, you're winning friends here with that type of talk.
Well, I'm not quite sure what the explanation is for it, given that you would be providing exactly the same advice and putting a jab in an arm. There's not as far as I know, the efficacy of either AstraZeneca, which you're distributing, but the same with Pfizer isn't improved or lowered by who puts it in the arm. And it's rather a very strange thing that is happening. So your involvement in the rollout is absolutely critical, and I know that has been very frustrating. But there's always the what if question that we find throughout history. What if you had been brought in earlier? We know that countries that brought pharmacies in earlier were able to reach higher vaccination rates faster. And that's because of that trust that's developed between you and to call them your customers is probably an underestimation as well. From my experience, they're more like community families, really, is the relationship that you have. Now, I do want to comment also on the other challenges which are there, because when the pandemic is behind us, older challenges will still be waiting for us to tackle and to solve. Labor certainly acknowledges that for those who can't access concessional arrangements, drug prices have just gone up and up under the last 8 years of Liberal governments. And it's not something that should have happened. And in a country where we're able to take in the universal health care that we have in the form of Medicare, it does go against the grain of our national character. And in our hearts, we very much believe in the principle of the fair go, just two words that mean so much in Australia. And yet 1 in 5 Australians now have trouble affording their medicines. They're being forced to make decisions like whether they should pay the rent, buy groceries, the essentials of life, or buy their prescription medicine. And it's very short-sighted as well, because of course, if people don't take their medicine and don't stay healthy, they're more likely to have an acute health event, which could result in hospitalisation, which results in higher costs to taxpayers as well. So that's something certainly that does need to be addressed. The government has had this on its table for some time, but we know that Scott Morrison's favourite phrases are things like "it's not my job," or "I don't hold a hose." He doesn't hold a dose either. So we'll await to see whether there's any solution there. And of course, solutions under this government, I think, often just wait. The old "it's not a race."
Yeah.
Well, it is a race, and they should get on with it. So I think that is very important. And so I think that our Shadow Minister for Health and Ageing, Mark Butler, is working with the Pharmacy Guild and others to find practical and sensible solutions to these problems. And I know that you'll be working very much with Emma, who's with us tonight, on that as well. Even amid COVID, community pharmacies have been toiling away to ensure that we keep on top of all the other challenges. And I've kept flu-free this winter, in spite of the very cold time I spent in Canberra, thanks to, as I said before, I always get my flu injections, in this case with Adele at the Roselle pharmacy there.
You wouldn't be going to get it anywhere else, would you?
She's a feisty character. I find it's easier to just say yes to Adele early on. I've got to say.
You and me too, mate. You and me too.
And I'm sure that would be my advice to you, Mr. President. Let me tell you.
Wise counsel.
Pharmacies are always there. So throughout every COVID outbreak from March last year, you've stayed open to serve the community and to deliver that critical health care. You've kept on dispensing critical medicines and providing advice, and I'm sure have kept visiting people as well and doing it in a COVID safe way. I know that the pharmacy across the road has no entry at the moment. They're just people queuing in the street. They say what they want because they're all known as well. It gets delivered, and I do want to acknowledge that. I know it can sometimes feel like a bit of a stretch to think back to life before this virus reached our shores, but trust me, we also don't forget how you kept operating during the long, terrible bushfire season, and that kept those communities going as well. So we want to acknowledge the pressure that you've been under over 2020 and 2021. Your doors have stayed open, and each one of us has been welcome to walk in without an appointment. So whether it's our cities or our regional towns or remote communities, you've worked consistently. And now that you're allowed to play your rightful role, the end of the pandemic is that much closer. If anything, I did want to say that our reliance on pharmacists has grown. The pandemic has further confirmed that we need to look at your role. Labor knows that you can do more for your communities. The role of pharmacists needs to be promoted, and we need to look at ways to expand your role to improve the health and well-being of your community. Change for the better is possible. Pharmacists didn't always give flu vaccines. Now it is an important service relied upon by so many in the community and has increased the rate of immunisation. Some pharmacists run sleep apnea clinics, others are diabetes educators, and now, of course, distributing COVID vaccines. Pharmacists can work to their full scope of practice without duplicating or splitting care. Pharmacists are highly trained experts who offer incredible services to their community. And we want you working at the top end of your scope of practice. In some areas, particularly the regions, a pharmacist might be the most accessible or indeed the only healthcare professional. And that's a point that should never be forgotten. And in aged care, pharmacists can and should play an important role as well. And Mark Butler will work with you on the response to the Aged Care Royal Commission. There's been some positive things done, but there's so much more needs to be done in the future. So in conclusion, can I say that you are very much a part of the backbone of the community? It's something that I've recognised. There used to be, when I first got involved in politics in Marrickville Council, there were always at least 2 pharmacists on the council.
Should be a prerequisite. Should be a prerequisite.
Indeed. Well, we're hoping to get one more in this area at the election in a few months' time.
Oh, so, it should be a cracker.
She would indeed. She would indeed. But and I'm very confident that she will get there. But it is a mystery to me why you were sidelined and not just part of the discussion. Read the rollout of the COVID-19 vaccine. Now that you're doing it, it is making a really positive difference. So my door is always open. I've had a long relationship with the Pharmacy Guild, both as a son of a disability pensioner, an invalid pensioner as it was called then, but right through my engagement in politics as well, including the period in which I was the Shadow Minister for Ageing and Seniors way back, literally 20 years ago now, in 2001, 2002. And since then, I got to understand how important your organisation is as a peak body. You shouldn't take for granted the fact that you have a single voice that you're able to channel. A lot of professions, that's not the case. That's the truth of the matter. And that makes you far more effective in advocating for government, but also for the alternative government that I hope removes that little title, shadow, or the other title, which is mine, of opposition before too long, when the election is due, whether it's at the end of this year or early next year. I'm very confident that we can move forward. And one of the things that I want to characterise a new government will be inclusiveness and collaboration, and you'll be very much a part of that. So thanks for the invite to speak to you this evening.
Oh, Mr. Albanese, Albo, thank you so much. And you know, the relationship that the Pharmacy Guild has, not just with your office, with Mark's office, of course, with Emma's office, but with all of your front bench, you know, whether it's Tenure or Penny, your doors are always open.
We're a friendly bunch.
You are, mate. You are. And, you know, we're pretty good too. We're pretty friendly also.
Yeah. That's right.
But you know, you touched on all of the issues that are of concern to my membership, and you know, and that's making sure that the people that we look after can afford to access essential medicines and to have a truly universal healthcare system. We don't just need a well-funded and properly run public hospital system, a well-run and properly funded MBS and NDIS, but the Pharmaceutical Benefit Scheme is one of those important pillars of Australia's universal healthcare system. And, you know, we saw the intergenerational report. It was delayed last year. It came out this year. And I've spoken to, you know, your office and your front bench colleagues about it. And the PBS is just completely flatlined over the next quarter of a century. It's not being invested in. It's not growing. And what are we seeing as a result of that is, sure, we're seeing a lot of new innovative medicines being listed for rare diseases, as we should. But really, that's coming at a cost that average Aussies can no longer afford their basic bread and butter medications for chronic diseases like blood pressure and high cholesterol and mental health. And just to hear you acknowledge that genuinely just means a lot. So thank you very much. So on behalf of Suzanne and I and all of the 6,000 pharmacies in Australia, we look forward to continuing to work with you in your current role and whatever future role may come your way, sir.
Thank you very much. Cross fingers.
Have a great night. Thank you.
Thanks very much. Bye-bye.
Thank you very much. Good night.
Good night.
Well, members, I think you can see that your guild not only has a strong working relationship with the government of the day, but we have a strong working relationship with the opposition of the day, who in our mind is an alternative government in waiting. There is only no such thing as an opposition. There is only the government and an alternative government. And it's our job as your peak body, as the single voice, as the alternative Prime Minister put it, to make sure that we represent you as fiercely and as frankly as we can. And I think that shows just the breadth and depth of issues that Albo is across, shows that those lines of communication are well and truly open. I will share with you at the end who our next guest speaker is, but let's get into this evening's briefing. So, ladies and gentlemen, the population over 12, so the data we're presenting tonight is not over 16 or over 18, it's all over 12s, and that is because of the updated information that has come in only recent weeks from the Therapeutic Goods Administration about updating the eligibility for both the Pfizer and the Moderna vaccines. And we're going to talk a bit about that, of course, tonight. But there are still just shy of 23 million vaccinations to be given, a combination, of course, between first and second doses. But there is still such a large market there, but there's also such a large need there that, as Mr. Albanese said, the Community Pharmacy Network, whilst we were brought on late, is going to play a very important role in ensuring that that 23 million gets closer to zero. So a snapshot of where we are today, just shy of 3,100 community pharmacies are actively vaccinating with the AstraZeneca vaccine. And in fact, we're getting close to the 500,000 vaccines, and we will reach that in the next week. So 425,000 vaccinations. But how is the rollout going? And I'm going to talk about now Moderna. I promised you I would, so here it is. So we've shown you a previous graph before of the comparison of the AstraZeneca vaccine and the Pfizer vaccine about reducing hospitalizations, reducing ICU admissions, and of course, reducing the incidence of death. And as you can see, the Moderna data there that was considered by the Therapeutic Goods Administration for the listing of Moderna, it is as good, if not better, than the Pfizer vaccine. So, of course, not only is the Guild working with the Commonwealth Government and its bureaucracy to ensure that those doses are secured, delivered, and we are paid, but of course, all of our branches, our wonderful branch directors and our ever tirelessly working branch presidents are busily working with state and territory jurisdictions. Of course, Western Australia, Victoria, and South Australia have the gold standard of legislative frameworks, and of course, whatever drug is listed on the Australian Register of Therapeutic Goods for vaccinating against COVID-19, for whatever age group, those states are, already have the proper approval processes in place. But we are working with the mosaic of approval processes, and we can assure you that we have spoken to every Premier's office. We have spoken, and the Prime Minister's office is also working hand in glove with us on this to ensure that by the time the Moderna vaccine arrives in your pharmacy, you will be able to administer it for whatever patient cohort is approved by the Therapeutic Goods Administration. So don't worry about the age, don't worry about the eligibility criteria. When it comes to the state, we will handle that. If there's an exception to it and we haven't had, we will get in contact with you, but please don't let it bother you. We are busily working away at that. Now, as we said when we started this webinar series, there is a difference between the approval and the eligibility. And this comes down to the Therapeutic Goods Administration and ATAGI, the Australian Technical Advisory Group on Immunisations. Remember, the TGA is supreme. So let's address this, because I've had a lot of questions through social media, and of course, a lot of questions that were submitted to Suzanne when you went through the registration process. So we have 4 vaccines approved by the TGA. Of course, 3 of those the Commonwealth Government has secured supply arrangements with, and one of those being the J&J vaccine will probably not form part of the Australian Government program. But the Moderna vaccine, or Spikevax, but we're not going to use Spikevax in any of our messaging to Australian consumers. We'll just simply be referring to it as the Moderna vaccine, was originally approved for 18 years of age and over, as was the Pfizer vaccine. But then the TGA reassessed once further data became available, and both mRNA vaccines, Pfizer and Moderna, are approved for all Australians over the age of 12, both of them. Now, 1 million vaccines will be arriving in Australia this month, and I've got a slides and I'll talk to you about the availability and the staging and when you're going to get it. So we'll go through that in some detail in a moment. But 3 million will be arriving each month from October, November and December. So we get to the 10 million by the end of the year. So we are going to be preferencing, right? We're going to be preferencing the 12 to 59-year-olds in the first instance until those supplies really ramp up. Remember, if you're over 60, you can still receive the AstraZeneca vaccine. Now I know, and I've had questions from many of you, that some people either don't want it or some people legitimately, for whatever medical reason, can't have it. They will be able to receive the Moderna vaccine from you. We just need to make sure we preference in the first instance the 12 to 59-year-olds. So you can still vaccinate the over 60s with Moderna. I can assure you, as the ATAGI changes its advice for the eligibility criteria, it will do it for all mRNA vaccines in the same way. We are not going to get a different availability or a different preferencing for Pfizer versus Moderna. It is our job as health leaders, and it is our job as the Guild, as a health spokesperson nationally, to simplify the messaging and to not confuse the messaging. So what we are going to do is ATAGI was meeting today. It will issue some advice and guidance in the coming days on phasing, right? But it will be the same for Pfizer as it is for Moderna. It will be a simple mRNA phasing. Let's talk about the stock. It's the vaccine we've all been waiting for, so you no longer have to wait. But as I said, we're receiving 1 million in the first month, and we're receiving 3 million in the subsequent months. So we have around 3,600 pharmacies that have completed the expression of interest process. I'll talk about that again in a moment as well, because there has been some communication from various franchises that has confused it a little. So we'll give you some clarity this evening. Tranche 1 deliveries are next week. You will be receiving, if you are part of Tranche 1, communication from PPA in the next 24 to 48 hours. You'll be receiving an email from PPA in the next 24 to 48 hours to confirm if you are part of Tranche 1. If you do not hear anything in the next couple of days, please don't fret. You will be part of Tranche 2 or Tranche 3. The way the government selected which pharmacies are in which tranche is simply based on your data of throughput you have already put through with the AstraZeneca program. So those pharmacies that have already had a high level of demand will be prioritised first, but I can assure you all states and territories are represented in all 3 tranches. So 1,200 next week, 1,200 the week after, and of course 1,200 plus to bring us up to full activation by Saturday, the 2nd of October. Now let's talk about training. The modules are already up on the Australian College of Nursing COVID-19 training platform, but they're going to be updated. So many of you have asked me questions about whether you should jump on and do it, and I've advised all of you I would wait until it is updated, but I can confirm that the Moderna module will be updated this Friday. So you've got something to do over the weekend. So if you are part of Tranche 1 and you receive that email, please make sure as soon as the updated one is loaded up, you hop on and do it. And the Guild has been advocating to ensure that all of those modules are now accredited for CPD points. Ordering Moderna. I told you I'd speak about the EOI process. If you responded to the simplified and accelerated expression of interest process that was put out on the 26th of July, you don't have to do anything more, all right? The government already knows whether you've ordered vaccines to date or not. If you completed the expression of interest process, you will be part of those tranches. If for whatever reason, you only did the first one way back at the beginning of the year, or for whatever reason, you've chosen not to participate yet, please pop on to the PPA website and complete the simplified and accelerated expression of interest process, and we'll pop you in the queue and we'll add you to tranche 3 for the rollout. As I said, there are about 3,600 pharmacies that are approved and ready to go out of the 6,000 pharmacies in Australia. So there's over half, but we would love as many of you as possible to participate. And if you are waiting for an mRNA vaccine, wait no further, please jump on and participate. Now I'm going to talk to you about AstraZeneca stock. We have a lot of stock in the system. Over around 1.5 million AstraZeneca vaccines have been ordered, but we've administered just over 400,000 vaccines. There's over 1 million AstraZeneca vaccines sitting in fridges. So if we look at New South Wales, so the hard bar graph is the number of vaccines that have been administered. Go New South Wales. The line is the percentage of those vaccines. So this is now over on the right-hand side axis that have been administered. So the 700,000 vaccines that have been ordered by New South Wales pharmacies, only about 35% of them have been administered. In Queensland, similarly, 335,000 vaccines have been ordered, but around 19% of those have been administered. So as you can see, there's an awful lot of stock sitting in fridges. You will still need this stock. You will still need it to complete your second doses, and you will still need it because there will still be demand for AstraZeneca over the coming 2 months at least. Because remember, it's going to take us 2 months to ramp up to the full 3 million a month of the Moderna vaccine. So in the interim, as we are phasing eligibility through a target, you will still need to supplement your Moderna program with AstraZeneca. So you'll still need it for boosters, or the second shot, I should say, and you'll still need it for those people that are over the age of 60. Now, my call out to all of you is, please, the quickest way for you to order stock is to transfer it from a mate. So if you're out there and you're running low on AstraZeneca, please don't order more from the Commonwealth. Please call your mate down the road who's probably sitting on an awful lot and get them to transfer it to you. Remember, it's completely fine to horizontally move stock, meaning transfer it not up and down in the supply chain, but sideways in the supply chain. You just need to update the CVAS system every Friday to say you've either transferred it out or you've accepted it and transferred it in. So my call to you all tonight is to please keep going hard with AstraZeneca. There's still at least 2 more months left of AstraZeneca in the program, but please make sure you're sharing stock around. Ring a mate, send a WhatsApp message, send a text message, do whatever these you do when you communicate amongst yourselves on the ground, but please share out the remaining AstraZeneca stock. So latest updates. Employee vaccination program. I'm very pleased to say that the Guild signed an agreement this week. Well done, Suzanne. She bedded this one down for us all, her and her team in Canberra. They're doing a great job being in lockdown. But they've secured the Australian Logistics Council. As you know, many of our chief health officers have said the virus doesn't move itself. People move the virus. And of course, even though we are locked down in most of the country, essential workers such as our delivery drivers, our freight and logistic network are still going and are still able to cross borders because, of course, we need to eat and we need to clothe ourselves and we need to do all of those things that we need to do. So a big call out to our freight and logistics people for keeping our country moving while the rest of us are in lockdown. But we need to protect these workers. And we have seen a few near misses over the Western Australian border and the Queensland border and even in the South Australian one, where logistic and freight drivers completely innocently carried the virus with them. So we've teamed up, we've been proactive. The Guild reached out to our sister peak body over at the Australian Logistics Council and said, you know what, this is a threat to everyone's safety. How can we help? And Suzanne was able to bed this deal down. So kudos to you, Suzanne. COVID-19 vaccinations in the workplace. This is just a reminder that you all have an obligation. It is a workplace health and safety obligation as an employer to not only actively have conversations about being vaccinated with your staff. We can't mandate, we're not forcing them, but you need to document that you had these conversations, right? Because COVID-19, the Delta strain, is coming to every single one of our communities, and every single one of us on our call, all of our staff will all be exposed to the Delta strain. All we are doing with border closures and restriction of movement of people is delaying the inevitable while we can increase vaccination rates. So please, you have an obligation, not just as a primary healthcare provider, but you have an obligation as an employer to actively have this conversation with your staff and document that you had the conversation. Rapid antigen testing, or as our New South Wales branch director told me, it's called a RAT. So I had a bit of a giggle with that one. Not a RAT test, it's not an ATM machine, but these RATs are quite topical at the moment. Because this intersects not only between what the Therapeutic Goods Administration approves nationally and places on the ARTG, the Australian Register of Therapeutic Goods, but it also intersects with state-based public health directives. Who needs to be tested, when you're tested, what tests our different states and territories acknowledge as being compliant and having fulfilled our obligations under those public health orders. But then, of course, there are workplace health and safety obligations, again, as employers and employees. And these things, these sands are shifting every day, but they're all controlled at state and territory levels. So our branches, again, are doing a marvellous job at ensuring that they're communicating the constant changes in public health directives in this space. But what I can tell you here is give you that link at the bottom of the screen. Take a photo of it with your phone. Please hop on and go and have a look at the FAQs on the TGA's website. But I just want to say this. There are many rapid antigen tests available, and there will be many more that will become available, and there will be a very high demand for them as we transition to COVID normal in the new year. But they must be supervised. So under the Australian Register of Therapeutic Goods terms and conditions, you cannot sell these for public use, but you can procure them and use them for testing your staff. Under the guidelines, though, you must supervise, if not administer, but you must supervise the staff member carrying out the test on themselves. But then you also have an obligation under those public health orders to notify your states if there is a positive test. So it's not just complying with the TGA on where you can buy them, what you can use them for. You have a legal obligation to comply with your state and territory regs, right? So if there is a positive case, you have an obligation under that directive to report that case, and you have an obligation to refer that patient for a full PCR test. So please just keep reading up on this. We'll keep drip feeding the information to you as it becomes available. Now, like we didn't have enough to do, but we need to deal with these nutters, and they are nutters, right? I'm getting bombarded on social media about it. I've been receiving death threats and all sorts of stupid things. And I know you've been receiving some stupid letters, and it has caused completely unnecessarily some angst. So we have a fact sheet. The fact sheet was emailed out to everybody, but you can get it on our website. It's freely available in the publicly accessible COVID-19 point on our website. So there is a fact sheet on there, but I just want to tell you all, please don't stress out about it. You've got enough to worry about. There is no legal reason for you to respond to these communications at all. But if you want a bit more comfort and a bit more of a deeper dive on it, please pop on and have a look at the fact sheet. PDL also did a fantastic thing. They've been a great partner of ours, PDL. They released the top 10 things that you need to do to prevent errors. I'm just going to quickly run through these because I've had reports of all 10 of these in the last 2 weeks since we spoke. Please, please, please check the air before you administer, not after. Please check the patient's date of birth, especially now that we are having 2 different vaccines available with 2 different TGA approvals, one that can be given to under 18s, one that cannot be given to under 18s. Please, it's not just making sure, and you need to do that before you administer. So it's not just making sure the person is 12, it's also making sure that if they're under 18, you've given them the right one. Ask the patient just before you're about to put the needle in, just say the name of the vaccine. So I'm administering the AstraZeneca COVID-19 vaccination to you. Oh yes, it's just a great final check. I'm about to administer the Moderna COVID-19 vaccination to you. Oh yes, good. Demonstrate good hygiene. We've just had a lot of reports of people just forgetting to do the basics. Make sure you've got the pump sitting in the room, and for goodness sake, use it every time. Make sure they see you doing it. It's not good enough just to do it. Every person needs to see that you've sanitized your hands before you touch them. Check patient contraindications before, not after. Ensure a patient remains in the pharmacy for 15 minutes. They need to stay in the pharmacy for 15 minutes. Record everything in the air. every time. I know there's a bit of an extra bit of difficulty that we have to do with people that don't have Medicare numbers. We've been over that in the past. Conduct a risk assessment and record informed consent. Informed consent is slightly different in every state. Some it needs to be written, but in vast majority, even if it is written, it can be digital anyway. Provide guidance on adverse effects. Remember that great one-pager that we did with the college, PDL and ourselves? Make sure you've got plenty of those in, for goodness sake. It's so easy, but hand them a bit of paper before they leave. And ensure correct volumes are drawn up. You can use your interns, and you can use and in one state you can use pharmacy students to help you with this. But remember, you are ultimately responsible. So please make sure that you supervise that. Our last big green tick down the bottom there. We now have a fully operational no-fault compensation scheme delivered in Australia. And I just want to thank our friends at PDL. I know you have choice in your professional indemnity insurance, but I can assure you the only professional indemnity insurance provider that put any effort in to ensuring that you were covered for this new full scope of practice service was PDL. No one else attended any of those meetings. PDL was the only one. So I know you have choice, but do the right thing and choose PDL. Guild care enhancements, as I said about that age before, there's been a new safety check just put in, not just at time of booking, but now at time of opening that booking and confirming it as well. It's just an extra check and balance. We should be doing it anyway, but hey, it's good to have an evolution as we get data. This is my favorite slide. Suzanne told you I was going to talk to you about a few new things, and the alternative Prime Minister spoke about this in his speech. This is co-payments, ladies and gentlemen, from 1960 to 2021, and we have ripped out inflation. So they are all in 2021 dollars. As you can see, and Albo specifically referred to, those patients that are not on a healthcare or concession card can no longer afford their medicines. We do not have universal healthcare in Australia if every element of Australia's primary healthcare system is truly accessible to all Australians. So those working poor, the people that are not on a lot of money, but are not eligible for a concessional healthcare card, 1 in 5 of them in marginal electorates, and 12.5% of those on average around Australia are not getting their medicines dispensed regularly. Compliance and accessibility are only one part of the quality use of medicines in Australia. If people simply can't afford to get the basics, what is the use of having big, shiny tertiary hospitals with bells and whistles when people are being hospitalised simply for chronic diseases that could have been easily and cheaply prevented? So we are working hand in glove with the government, but I have to tell you, here today, we are getting a much more severe from the opposition on reducing the general co-payment. $41.30 is ridiculous for a chronic disease medicine. It is far too expensive. It is out of reach for an essential service for most working Australians. And if you're on 1 or 2 or even 3 medicines, it's completely unaffordable. That $41 co-payment needs to halve, and soon. The amount of money that we have wasted over the course of this pandemic because we could have done things more effectively would have been far more efficiently spent if it was invested in restoring the principle of universal access to the Australian pharmaceutical benefit scheme. And that is exactly what your guild will be taking to the next election, not just on your behalf, but on behalf of all of your patients as well. So stay tuned in this space. There'll be more to hear. I just want to give a bit of a shout out as well to the Australian Pharmacy Council. God, it's hard to get staff at the moment, especially with those hospitals building up empires and putting more and more people on it. So, you know, Suzanne had a great meeting today with APC, and I've just got a couple of slides and a few points I want to share with you. CAPS, or the Knowledge and Assessment of Pharmaceutical Sciences exam, so those people that are coming in from overseas, because your guild was able to lobby the government to have pharmacy as an essential worker put on the priority migration skilled occupation list. And we only had that win in the last couple of months. So within the last 8 weeks, there has been a 75% increase in the number of people that have applied to do that exam. 65% of that increased amount are already sitting here in Australia. They don't need to get on a boat or a plane and come in through a hard border and quarantine for 2 weeks. They're already here They're fully qualified pharmacists and registered in other comparable countries. There was just a blockage to get a visa to be able to work. And so this will add an extra 120 registered pharmacists, which I know is not huge, but to be honest with you, it's like adding another whole university cohort of graduates in. So imagine adding another University of Sydney into the mix, or another Monash University or UQ, one of those three big schools. That's exactly what this does. And it wouldn't have happened if the Guild hadn't got that change and advocated for a couple of months ago. But listen, we're still doing more. There's the great work that AHPRA and APC are doing on the temporary pandemic sub-register. There's 1,755 pharmacists that had recently let their registration lapse that are now back on, that have said, you know what, I'm happy to help. And they are completely registered for the purposes of assisting with the COVID-19 vaccination rollout. So there are 1,755 people out there that chose to have their registration reactivated because they wanted to help vaccinate. So get the word out. And if you are looking for somebody not to dispense, but to assist you with this extra service. Another thing that we've been working on, a big shout out to Anthony Tassoni, our Vice President for Health, Economics and Policy, and of course our Chief Pharmacist, Chris Flood. Those two gentlemen were advocating tirelessly for these things. These things are due to expire on the 30th of September in a matter of weeks. And they've had some win to get them extended to 31st of December. Digital image prescriptions will be rolled over and still valid. Expanded continued dispensing. Prescription signature exemptions. No one needs to sign anything. You haven't been had to sign things for a year and a half. You still won't have to. And of course, the paid home delivery service. All of these things will continue until the 31st of December. None of them will be expiring in 2 weeks as they initially would. So well done, gentlemen. Thank you very, very much. That'll make a huge difference. We've got a lot of issues in the CTG space. Got 4 minutes left, Suzanne, we can do this. In the CTG space, again, the warning, the 810 warning code via PBS Online, that we've had that extended to the 31st of September. It was supposed to end on the 31st of August. So we've had that rolled over again, but please make sure. So you will still be paid. So if you get the 810 warning, right, you will still be paid. This is for people that might present with a CTG script, but their doctor hasn't properly registered them for CTG, right? This came into effect on the 1st of July. We're able to get a moratorium put into the 31st of August. We've had this extended to the 30th of September, so only for another couple of weeks. You will still be paid. But on the 1st of October, that will be rejected, and you will have to explain on the front line to that Indigenous person why they're not getting it for free, they're paying $660, or why they're not getting it for $660, they're paying $41.30, right? So you've got another 2 weeks. So please don't ignore those warnings just because you're getting paid. That is a motivation for you to have a conversation with the person's prescriber, because let's face it, you're not going to be having a conversation with the patient. They won't understand it. Please make sure you reach out and make sure that prescriber does the right thing and properly registers them. APP, Rego's open. We had a cracker of one this year. It was so good to, wasn't it, Suzanne, to meet with people face to face after such a long period of in between drinks. And I know a lot of conversations went on about Hawke in those introductory remarks, but if Hawke was here, I've had no doubt he'd say, let's get back to the pub and have a beer, do the right thing and get vaccinated. And I think there's a bit of a mural of saying exactly that somewhere in Canberra at the moment. Simon, our president there, said. So listen, there's a 100% refund guarantee. You can book with confidence anywhere in Australia. If for whatever reason you can't travel, you will get all of your money back, or you can give it to a friend or do whatever you want. But I'm telling you right now, it's open. The first 200 registrants get an extra discount. So jump on now and avail yourself of that. So just to recap for tonight, if you're not onboarded for AstraZeneca, please do so. There's still extra 2 months left in that program. Ask every person every time if they have been vaccinated, if they've had their first or second dose. When the update of Moderna goes live on Friday, wait for the update, go and do it. See if you can transfer stock to your mates if you've got too much and they don't have enough, or if you need some, ring them first and see if you can take some excess off their hands. Start having conversations with your team. You must have, to satisfy those OH&S requirements, actively have a conversation and also document that you had that conversation. Set up your Guild corporate health booking portal to start receiving bookings for things like that Australian Logistics Council. So we'd love more of you to be involved in that program to create more access points. Please make sure your air real time is activated. Remember, you've got to check it before, not after you vaccinate. And of course, lucky last, make sure your URL we're still getting, it's still amazingly at 1.2 to 1.3 million hits a week on the Find a Pharmacy website. It's just not tapering off. So please make sure you check your My Guild. So go on to guild.org.au, log into your My Guild site and make sure that your pharmacy's unique URL is put on there if you don't use GuildCare. If you use GuildCare, we've already done it for you. Of course, friends, if you have any questions, if there's anything we can do to help, email us at covid19@guild.org.au. We are going to keep working. We're not done yet. All Australians deserve to access all vaccines through all community pharmacies. You will be able to, I forgot this one, you will be able to vaccinate off-site for Moderna. You will be able to vaccinate off-site for Moderna, whether it's in a residential aged care facility, whether it's in a high school, whether it's in an Aboriginal community. We are working on getting those business rule changes through, and as I said, changes through state and territory legislations, but this is a game changer as well, right? So all of those people, and I know Judy Plunkett, I can hear you. She's been asking me to get this change for many, many months. We didn't think it was going to be possible to next year, but we've done it. You'll be able to offer this service as soon as you're switched on in whichever tranche. So we'll keep working with the states and territories as well. In closing, friends, our next special guest speaker, Emma McBride, helped us secure him, but the Honourable Mark Butler MP, the Shadow Minister for Health, will be our special guest in 2 weeks' time to talk about not just COVID, but to talk about what pharmacy may look like and what the PBS may look like under an Albanese Labor government. So friends, thank you very much. We've kept it to the hour as we always do. Remember, I know you're tired. I know you haven't had a holiday in nearly 2 years. I couldn't be more proud of all the efforts that you're putting in. I know Suzanne's just as proud as I am, but if there's anything we can do to help, pick up the phone and call 13Guild or email us. We're only a phone call away. Over to you, Suzanne.
Thank you, Mr. President. In view of the time, we'll wrap up quickly, but thank you, everyone. The fact that we, get over 1,000 plus people every fortnight coming to these webinars, really appreciate that everyone is really working hard to be so engaged and support everything that's happening. So yeah, as Trent said, could not be prouder. So thank you very much, everyone, and good night. Thank you.
Good night, everybody.